Thank you very much. Thank you, Dr. Muzanguzi. Let me first wish welcome to all our colleagues and delegates from different countries of the Eastern African Reproductive Health Network. Thank you for joining us. Dr. Jota Muzanguzi, Director General of National Population Council of Uganda, representative of development partners, distinguished delegates representing the Eastern African Reproductive Health Network member countries, ladies and gentlemen, very good morning. It's a great pleasure for me to be here this morning, despite this small problem, and to address you during these 2 days of this 11th Eastern African Reproductive Health Network coordination meeting. Let me take this opportunity to thank my colleagues at PPD ARU for inviting me, and I congratulate them for the good preparation and organization of this important meeting. I also thank all of you colleagues from the respective countries of Eastern Africa who have been able to attend and participate in this meeting using this the new normal. Finding time out of your busy schedule to consistently be part of this networking is a great honor to us and cannot be taken for granted. It's indeed a testimony of your commitment to the objectives of the EARHN, as you've always given this forum your utmost consideration. And I would like also to thank the government of Uganda, which hosts PPD ARU and contributed and supported its activities. And in a special way, the Ministry of Health, that I'm informed is represented at the commissioner level at this meeting, for all the help they have provided and accorded to PPD ARU as they run such important forums and networks. Let me start by telling you a bit of history about this unique way of working at PPD. PPD is an intergovernmental organization established during the ICPD in Cairo in 1994 to institutionalize and promote South-South and triangular cooperation in family planning, reproductive health, population and development issues. Our organization is currently chaired by South Africa and headquartered in Bangladesh, comprises 27 member countries from Asia, Africa, Latin America, and the Middle East, and represents the voice and aspirations of over 60% of the world population for a better health and welfare through advocacy and policy development, documenting and sharing best practices, capacity building and networking, and technical assistance. Our Africa Regional Office, PPD ARU, which is convened as for the 11th time as EARHN is a product of the 2006 PPD board meeting that reviewed member countries' performance on ICPD program of action and the MDGs, and found that Africa was lagging behind. And they made a decision to reinvigorate South-South cooperation in Africa by establishing a regional office based on the African continent. The government of Uganda then welcomed PPD Africa Regional Office in 2007 in Kampala, where they provide office space, utilities, and support staff. And here I wish to express my sincere thanks and gratitude to my friend, a long time, Dr. Jota Muzanguzi, for his great efforts towards the establishment and functioning of the PPD ARU. Distinguished delegates, ladies and gentlemen, the objective of the Eastern African Network is to enable member countries undertake advocacy geared at improving reproductive health outcomes within the member countries through South-South cooperation. And I salute EARHN's first coordinating office that was located at the NCPD in Nairobi, Kenya. And I thank the government of Kenya for the continued support to PPD since the launching of PPD, as Kenya was a founding member of our organization. And in the earliest phase of work, activities for the network included provision of technical assistance, coordination of programs, experience sharing among the countries, and production and distribution of EARHN newsletter brochure. The Eastern African countries share similar social, political, demographic, and geographic environments, and South-South cooperation has untapped potential for approaching new opportunities and sharing good practices in the field of sexual and reproductive health and rights. Eastern African countries have extensive experience in sexual reproductive health and rights on which to build a new collaborative effort to initiate change in country and regionally in order to improve the health and rights of all people. Networking and formation of strategic partnerships would broaden the resource base for addressing sexual reproductive health rights issues in the different countries of the EARHN and help diversify the experiences and pool expertise for sexual reproductive health, population, and development issues. I was informed that yesterday EARHN was involved in a session for capacity building, information sharing, as well as exploring South-South solutions to the sexual reproductive health challenges in the sub-Saharan and particularly in Eastern African region. The focus on preventing unsafe abortion was a well thought out topic, as it is indeed a challenge, not only in Eastern Africa region, but in the world at large. And I thank the team of experts from the Guttmacher Institute, as well as African Institute for Development Policy, AFIDEP, for facilitating such a brilliant deliberation on such a challenging issue. I'm aware that the objectives of today's meeting are to continue sharing progress made, challenges, lessons learned, and opportunities with regard to implementation of this network, soon ending the strategic plan 2017-2021. You have come to share innovative programmatic experiences and good practices that enhance the implementation of the same strategic plan. It's my prayer that you develop country action plans for further implementation of the plan over the subsequent 12 months. I know must have been challenging implementing the EARHN strategic plan and other sexual reproductive health commitments during this roaring COVID-19 pandemic time. But I congratulate you all for the fight and resilience that you have put up to live in the new normal. This is manifest in the fact that you have not sat back to wait for possibilities of traveling, but brought us together to discuss these issues and meet online. We all recognize you, honorable delegates to this network. And now that you hold special positions in your respective national public services, as well as in the society, as implementers and champions of sexual and reproductive health programs. We look up to you to voice the need of working to improve sexual reproductive health and rights of our people. We do have trust in you as strong allies and stakeholders in the field. That's why we believe and are keenly devoted to working with public servants at your level as change agents and central place to the full implementation of international and regional agreements on sexual and reproductive health and rights. Our countries have very good and clear policy frameworks which require renewed commitment to support the implementation of these good policies. In November 2019, while at the Nairobi ICPD 25 Summit, a number of our countries, led by the top leadership of our respective countries, re-echoed their commitment to the implementation of the ICPD program of action. I therefore see a lot of hope in this network to make this a reality and make it happen. I'm hopeful that this meeting will provide an opportunity for all of us to have a critical look at our own strengths and opportunities, as well as areas where we can learn from one another in our future advocacy work, networking, and sharing of experiences. And I'm also hopeful that this meeting will help to reinvigorate and lay a strong foundation for long-lasting and mutually beneficial partnerships and collaborating arrangements in addressing challenges of reproductive health and development in the region. On behalf of PPD and on my own behalf, I'm therefore very pleased to associate myself with this meeting. We look forward to reinforced collaboration between and among you all, members of your respective ministries and governments, civil society organizations that work of sexual and reproductive health and rights. PPD, through its regional office in Africa, commits to continue providing an enduring space for mutual exchange of best practices and leveraging resources for facilitating the improvement in sexual and reproductive health and rights outcomes in our respective countries. I wish you a fruitful, successful, and resultful meeting.